In this video, we will go over the most common possibilities as to why teeth become sensitive and painful to cold. For each possible cause, we match it with a possible diagnosis, along with treatments and remedies. As always, I will break it down so it's easy to understand so you can actually comprehend a pretty complex topic. But first, we start with a brief overview of cold sensitivity in teeth. I'm Rick Buck and I've been a dentist for 15 years, so like and subscribe if you have teeth and you want to keep them. When a patient comes into my office for any kind of toothache, the first thing I want to know is, are they having cold sensitivity? Because this is the symptom that tells me the most about the cause of their pain, so I can accurately diagnose and treat it. If they do have cold sensitivity, I want to know three things. How intense is the pain to cold? How long does the cold pain last? And where specifically is the cold pain or sensitivity coming from, if they can pinpoint it at all? Those answers will tell me almost everything I need to know about their pain so that I can accurately diagnose it. So you can better understand why that makes it easy for me to diagnose, I'm going to explain to you two routes or mechanisms of cold sensitivity in teeth. Route number one has to do with the inflammation or infection in the tooth. What happens here is that if the tooth has inflammation in the center of the tooth called the pulp chamber, the nerve in that chamber becomes more easily excitable or stimulated, shall we say. So what that means is it will take less of a stimulus to set off a pain signal to the brain. So if you have inflammation in a tooth, maybe just lightly tapping on it, while most teeth it'll be normal, the inflammation will make that tooth more excitable and it will set off a pain signal. For cold, this means a normal amount of cold causes the tooth nerve to become painful as well. On top of that, cold constricts the tooth and increases the pressure of the inflammation in the tooth as well, and in turn sets off a pain response to the brain. For the rest of this video, we will refer to route number one that I just explained as an inflamed pulp or pulpitis. The big question here is what is and if something is causing pulpitis. Route number two. I will explain route two like this. If you remove the enamel from your tooth and looked at the underlying level of your tooth with the microscope, you would see a surface of tubules, almost like a wall had a bunch of tubes in it. These tubules are connected to nerves, which ultimately connect to a center nerve in the pulp chamber of your tooth as well. But what's important to know is that the bigger the diameter and the more of those tubules there are in each tooth, the more likely that tooth or each individual will experience pain if they're exposed to something that sets that pain off. So the more of that surface area of tubules and underlying level are exposed, the more likely you'll have cold sensitivity. Now, most of that underlying exposed tooth surface is called dentin. So route number two, we will now refer to as dentin hypersensitivity. Route one, pulpitis. Route two, dentin hypersensitivity. The question again with dentin hypersensitivity is, what is causing the dentin hypersensitivity and if something is causing it. Now, the next step is placing cold on the teeth to determine which of these two kinds of cold sensitivity you are experiencing. If cold is placed on a tooth with dentin hypersensitivity, then what will happen is it will set off the pain response with varying degrees of intensities, depending once again on each person and how many of those tubules and how big they are. So that doesn't tell us much in this case. In other words, dentin hypersensitivity, the pain can be very subtle or very painful, which varies from person to person. But more important than the intensity of the pain is how long the pain lasts. That will tell us a lot. Dentin hypersensitivity pain will likely only last for a few seconds, almost going away right after you remove the cold object. If it's really painful dentin hypersensitivity, sometimes it does last longer. For most dentists, we use a cold Q-tip to apply cold and test each tooth for dentin hypersensitivity. But that test can be tested with the corner of a shard of ice if you don't have what we have, that cold to place on a Q-tip. Either way, if the cold pain lasts longer than 3 to 4 seconds, likely it is not dentin hypersensitivity causing the cold pain. Instead, it is more likely due to inflammation or pulpitis in the tooth, which I will explain in just a second. Dentin hypersensitivity can be remedied in a few ways. If you or the dentist finds the exposed surface, the first remedy that you can do is cover the exposed sensitive surface with something, which most likely will be performed by a dentist depending on what the tooth needs to cover it. If you are in a lot of pain and can't immediately see a dentist, some pharmacies have temporary fillings. I will link to a temporary filling as well as all my favorite dental products in the description below this YouTube video, including my favorite toothbrush and floss. I have review videos of all my favorite products on my channel where I show you how well they clean my teeth. I recommend everyone watch my daily tooth care video so you know how to really take care of your teeth with the best products and the best techniques. I will post that video and it will pop up at the end of this video. Okay, the second remedy for dentin hypersensitivity is anti-sensitivity toothpaste. While it doesn't work for everyone, for some people, anti-sensitivity toothpaste does work really well. The longer you use it over days and weeks, the better it tends to work at reducing sensitivity. It basically plugs off those little tubules so they can't become as triggered as much to a stimulus. I will link to my favorite anti-sensitivity toothpaste in the description as well. The third remedy, sort of, is to stop whatever is making dentin hypersensitivity worse. I will go over these causes in more detail in a moment. The last permanent remedy is to have a root canal. It is the last resort, but sometimes it is the only way to get rid of the pain from dentin exposure. Root canals aren't as bad as everyone makes them out to be, and sometimes they are the only way to get rid of the tooth pain and cold sensitivity. But they are costly and it's best to avoid them when possible. There are a lot of other remedies for dentin hypersensitivity, but in my experience, they are mostly temporary. In my practice, I've stopped doing the other remedies because it seemed like I was misleading a lot of people into treatment that wasn't really that effective and gave them false hope as they would leave my practice thinking I did a lot, and in a couple days it would just come back. Now, let's move on to tooth inflammation. If tooth pulp has inflammation or pulpitis, it can be further divided into what we call possibly reversible pulpitis or irreversible pulpitis. You see, teeth are pretty bad at healing themselves, unlike most other parts of the body, but they can sometimes heal on their own. What happens is the tooth pulp will recognize some sort of insult to the tooth. Like, let's say you bump the tooth really hard. The tooth pulp will then become inflamed so that it can repair a lot of the damaged tissue, and the inflamed tissue will often repair itself and the tooth. However, other times it will not be able to repair itself and become more and more inflamed until it eventually gives out, then dies, then becomes infected due to the dead pulp tissue, and ultimately it will cause more pain. Initially, pulpitis can't really be seen on an x-ray. It isn't until the infection has really progressed to around the tooth that it shows up on an x-ray. But there is a way to determine which route it will go and diagnose the type of pulpitis, either reversible or irreversible. You can use a pulp tester or, once again, use a cold test. Unlike dentin hypersensitivity, if the cold test sensitivity lasts longer than 10 seconds, it is likely irreversible pulpitis. It is termed irreversible because while the tooth may feel better for a minute, the tooth will never fully heal at this stage. The only way to permanently treat irreversible pulpitis and save the tooth is to have a root canal treatment done, and the sooner that is done, the better the results and the success rate of the root canal. And again, for those afraid of the thought of a root canal, once you're numb, a root canal is just a boring appointment and shouldn't be that bad at all once you are numb. Now, if the cold test sensitivity lasts less than 10 seconds and longer than 3 to 4 seconds, it is possibly reversible pulpitis. I say possibly reversible pulpitis because reversible pulpitis always has the possibility to progress into irreversible pulpitis, which ultimately means a root canal treatment or extraction to fix it. Luckily, I have found a very good technique that I use for my patients at minimizing the chances of reversible pulpitis progressing into irreversible pulpitis, which I have even used on myself. It's easy. I tell my patients to take 400 milligrams of ibuprofen or whatever it tells you on the over-the-counter bottle 3 times a day for 3 to 4 days. Ibuprofen in this case isn't actually for the pain, though that is a good thing that goes along with it. Ibuprofen in this case is for its anti-inflammatory properties and can reduce inflammation just enough so that your tooth can optimally heal itself in this case. If I were to put a number on it, this works about 70 to 80% of the time for my patients with reversible pulpitis. If ibuprofen is hard on your stomach, you have two options to run by your doctor. He could also prescribe you a steroidal anti-inflammatory like Medrol, or you can take something like omeprazole, which is I think Prilosec OTC, before taking ibuprofen, which normally will calm the stomach down so people can take ibuprofen. Now let's get into the more primary causes that will induce either dentin hypersensitivity or pulpitis. The first cause of these two routes is a cavity or tooth decay. A cavity can cause pulpitis or dentin hypersensitivity. If the cavity is small to medium size, it will likely cause dentin hypersensitivity, if anything at all, as it exposes the underlying surface of the tooth. And to fix it, it will need at least a filling. If the decay is deep and has reached the center canal, it will likely set off pulpitis, be it reversible or irreversible. If a cavity is causing pulpitis, it will likely need a root canal at some point. However, sometimes it will only require a filling or a crown. Either way, the sooner the cavity is treated, the better. Gum recession is the next cause or trigger of cold sensitivity. I have a video more about gum recession, but if your gums recede, the root portion becomes exposed and will cause hypersensitivity too. To make matters worse, the roots of your teeth wear down faster than the enamel portion of your tooth, which creates notches in the roots, which in turn exposes more of those little tubules connected to your nerves, causing pain from dentin hypersensitivity. If gum recession is causing hypersensitivity, your options to remedy this are trying the anti-sensitivity toothpaste. My favorite anti-sensitivity toothpaste is linked to below this video. Also, a remedy you can have is a bonding or filling over the sensitive spot. This works most of the time, but also isn't 100% effective. If you have pain from the gum recession causing dentin hypersensitivity, and you just can't take the pain because it's too severe, and you have tried all else, then a root canal is the sure way of eliminating the pain as a last resort. In this case, other than the pain, you don't need the root canal. It's just if you can't get rid of the pain, that seems to be the only way. Also with gum recession, make sure you eliminate what is causing the recession, like brushing too hard, teeth grinding, or gum disease. Once again, I cover all of that in my tooth brushing videos. Moving on, like gum recession, worn down or flattened teeth can also cause hypersensitivity due to the thinning or elimination of the enamel layer. The common causes of dentin exposure will happen from teeth grinding, brushing too hard, too many acidic foods like sucking on lemons, too much soda, bulimia, acid reflux, to name a few common causes of worn down enamel. The remedies are just like gum recession: a filling on the sensitive spot, anti-sensitivity toothpaste, or root canals as a last resort. A cracked tooth can cause a large variety of symptoms, and too much to cover them all here, but a cracked tooth can cause either dentin hypersensitivity or pulpitis or other issues, so we won't go over them. Cracked teeth can be very frustrating for patients and dentists in trying to find a remedy or even trying to find the cause. Lots of teeth have fractures, so they just depend on where and how severe the fracture is if you're going to treat them. Tooth trauma, like hitting the tooth hard, as we alluded to earlier, can cause pulpitis. I recommend to my patients the ibuprofen anti-inflammatory remedy that I already covered in this video to start. And unless the pain is very persistent or too severe, that should do the trick. Normally, if you hit the tooth too hard or cause trauma and it causes pulpitis, we just monitor the pain and the signs for infection until they go away or progress into irreversible pulpitis, which then we would have to treat the tooth, and you know that that's normally likely a root canal now. If you've had dental work like crowns and fillings, those also can actually cause pulpitis or dentin hypersensitivity. Most of the time they help, but sometimes they can cause further issues. There can be even more causes of pain due to dental work, but those normally don't provoke cold sensitivity. If this happened to my patient, then I would recommend ibuprofen anti-inflammatory protocol like I've already gone over. In fact, this happened to me as a patient. I had a filling, it made my tooth sensitive, I took ibuprofen, and everything healed. Unfortunately, anytime you work on a tooth, there is the possibility of hypersensitivity, but a good dentist will do all to minimize the possibility, and if it does happen, they'll do a lot of things to try and help remedy the situation without going too extreme at first unless they need to. I go over more of pain after a filling in another video. But if the pain persisted with my patient after ibuprofen, I would simply redo the filling and more than 95% of the time that works and does the trick to get the tooth out of pain. A very small percentage will go on to needing a root canal. And once again, that's 95% of the patients that have sensitivity, not 95% of the patients I do fillings on. It's only a small percentage that actually will have sensitivity. Teeth whitening can also cause temporary cold sensitivity like dentin hypersensitivity. Normally it will subside a short time after the whitening has been stopped, but an anti-sensitivity toothpaste will help. Excessive acidic foods like sucking on lemons will also expose the underlying tooth to hypersensitivity. If you eat a lot of acidic foods, avoid brushing right after you eat, because this will more easily wear away the enamel of your teeth. But even if it doesn't wear your enamel thin, it can still cause cold sensitivity. Anti-sensitivity toothpaste works well here. Also, avoiding acidic foods will also help to stop this from progressing. Remember, my favorite toothbrush, floss, toothpaste, and other dental products are linked to below this YouTube video. Everyone needs to watch my daily tooth care routine video I have posted now, and I will show you in that video why it's the best way to brush and floss with the best techniques. Now, this video is part of a larger series of oral pain I am doing, so you can match up the symptoms we talked about here and watch more videos on a possible diagnosis and treatments. If in Southern California, my dental office is linked to below this video. Like and subscribe if you have teeth.